Hello, adventurers. Welcome to the NYCU lab of the brain and oral functions. Now, first of all, I'm not your tour guide or a map maker. I'm kind of adventurer just like you, walking and looking around in the research field. And I'm also a teacher in a dental school. When it comes to the dental job, you might immediately think about the teeth. But teeth are just part of the oral system. Dentists will look into the association between the teeth and the muscles and the oral structures and so on. And I am a multi-class adventurer. I received training in both dentistry and neuroscience. So I look into a deeper association between the brain and the oral system. And I will show you why this connection is important. My name is Joshua Lin, and right now I teach in both a Department of Dentistry and the Institute of Brain Science at NYCU, Taiwan. I think the best way to explain this is from your own experience sitting in the dental chair. We feel pain from toothache, and we feel anxious for whatever the dentists are doing. And we keep good oral health because it's important for us to chew and eat well. And people may become worse in their oral health due to aging, which is a critical challenge in the world. Now, all these things relate to not only teeth, but our brain. For example, chewing and swallowing, they are very complicated sensory motor processes, and these important in functions can be compromised with worse cognitive functions, as seen in the patients with dementia. So brain actually plays a very important role in our oral functions. We start to learn the connection between the brain and oral functions from an interdisciplinary view. That means we combine the research method from both sides. For the study of the brain, we mainly adopt magnetic resonance imaging, that is MRI, to perform a non-invasive imaging for brain functions and structure. And we analyze the association between the brain data and the oral functions. We also extend this model into a transdisciplinary research. For transdisciplinary research, we investigate the association between the brain, oral functions, and our behavior altogether. Now, let me give you some more examples. For interdisciplinary research, we can use MRI to investigate the individual difference in brain morphology, such as the thickness or volume of the brain region. And then we investigate if the performance of chewing is associated with the difference in the brain region. Furthermore, we design a new experiment to interfere with one's chewing performance. For example, here you can see that someone has worse chewing performance because the color of the gum they chewed is not mixed homogeneously after interference. And we are interested in whether the brain helps us to counter that interference. For example, sometimes some people may change another side to chew or spend more time chewing so that they can improve their chewing performance. In other words, we transform the associations between the brain and oral functions to a new topic. That is how people adapt their oral conditions to achieve normal functions. And I need to emphasize that there is an emerging trend to study the association between brain and oral functions in the whole world. And we are very active in this field. For example, we can use PubMed to do a quick survey on the number of publications on using MRI to study the brain and oral functions. Here are the number of publications from the top 10 dental schools according to the QS World Ranking. Some dental schools, such as Tokyo Medical and Dental University and Hong Kong University, they are leading in this field. And we also have the University of Toronto, the University of Sydney, and many other prestigious dental schools. They perform very well in this field. And our lab in NYCU is among one of these active research teams, judging from our publications in the past 10 years and also in the recent 5 years. So I'm not really a maverick because we have more and more people working together in the same direction. What we have done here can be classified into two categories. The first job is neuroimaging of brain functions. In some studies, we look into the brain functions associated with mental processes. For example, we use different methods to elicit dental pain or anxiety toward dental treatment. And we investigate the brain functions associated with these mental processes. We also investigate the morphological features of the brain, such as the volume of the gray and white matter of the brain. We also have some method to explore the pattern of how different brain regions connect to each other. And the individual differences in brain features may be associated with oral functions, which we need to assess accurately. So another part of our jobs is to develop and test this method. For example, we have developed a method to assess the ability to chew and mix food by quantifying color mixing of the food bolus. And we also design, test, and translate a variety of questionnaires about the patient's experience of dental treatment, such as dental fear and anxiety. These works help us to quantify the individual differences in oral functions and their behavior related to oral functions, which will have a direct contribution to clinical assessment and diagnosis. And as a teacher, my job is not only to push our research impact, which has been recognized in a recent academic report. The most important thing is to pass our experience to the younger adventurers. We are enthusiastic about joining international academic activities. For example, Dr. Wang from our group has received an IADR award for his poster about brain functions of swallowing. And I am especially interested in guiding college students. For example, the method to assess color mixing that I just mentioned is developed by one of our undergraduate students. And international students are most welcome. For example, in the past few years, I have co-supervised two students from ACTA, University of Amsterdam, for their externship research project. This is done fully by distant learning. And I'm also the author of the first textbook of neuroimaging and the association between the brain and oral functions, which has just been published by Wiley Blackwell. Well, I am merely a collector of the gems from other brilliant researchers. But you can see here that from this book, the trend to study the brain and oral functions is thriving now and in the near future. For lay persons and dental workers, I have prepared a short course entitled Brain Behavior and Dentistry. The course will be launched, if everything works fine, in late May this year. The course will be delivered by FutureLearn, an international provider of online courses. And probably the best way for you to learn more about all this, if you are interested in working with us, is to contact me. I believe that adventure never has an end because someone else will carry on the story.